Sex is very important. It's a basic human need, but patients who have sex and continue to have sexual relationships have a happier life. They are much more satisfied in their relationships. They tend to live longer. They tend to be more active. So that's a very interesting question, one of the most common questions I get. It's estimated that almost 20 million women in America suffer from painful sex. And it's really broken down into different areas that can elicit or can cause painful sex. I have a model here that breaks it down. So first areas of pain can be on the outside. So this is the external genitalia or the vulva. And there are a few basic conditions here that can cause pain. One is atrophy, and that's menopause, leading to low estrogen levels. The other one that a lot of people don't know about is chronic autoimmune or inflammatory conditions like lichen sclerosis. And most women can't see these, and so they don't understand that. The other place that pain can come from is the actual vaginal canal. And there are, this is the vaginal canal, and see how it has these nice folds in there. So a nice healthy vagina is like an accordion, and it stretches to accommodate a partner. When we go through menopause or take medicines that change the anatomy of the vagina, you can lose those folds. So the vagina becomes more like a tube sock rather than an accordion, so you can see that it'll be painful when you're stretching to accommodate your partner. The other disorder that can happen in the vagina is something called vaginismus, which is an involuntary contraction of the vagina that doesn't allow someone to either have intercourse or to even insert a tampon. And the reasoning behind this can be a nerve issue, prior painful experiences such as trauma or a bad childbirth situation, and can be depression, emotional factors that have led to prior sexual experiences that were traumatic. The other area that we need to look at that can cause physical pain during intercourse are our internal organs, our uterus, cervix, and ovaries. Women can have scar tissue from prior surgery. You can have a condition called endometriosis, where the inside lining of the uterus actually ends up scattered throughout the abdomen. There are GI conditions like Crohn's, ulcerative colitis, and then sometimes acutely somebody comes in with an infection and like gonorrhea, chlamydia, and have pain in their pelvis when they have intercourse. So depending on the etiology, or in other words, where the pain is coming from, there are lots of treatment options. There is, first of all, counseling to deal with the emotional side effects of what's going on. There are compounded creams, there are injections, there's biofeedback, there's physical therapy, and there are also medical and surgical treatments for all of these different conditions. Not having desire is once again another common complaint that I get from women. It doesn't mean that it's a permanent situation, but it's called hypoactive sexual desire disorder, and a lot of women suffer from it. And it can happen from medications. Once again, we had talked about antidepressants, birth control pills, or anything that can decrease a woman's testosterone and estrogen levels, prior trauma or pain, emotional causes. If someone's depressed or not feeling well, she's not going to have desire to have intercourse. Chronic medical problems can lead to a decreased desire. Problems in the relationship. So a lot of people think that it may just be a physical problem or a medical problem, but sometimes it's lack of communication. So that's where counseling comes in. Sometimes it's as simple as an imbalance in neurotransmitters in the brain. So that's the amazing thing. There are treatment options available. The FDA just approved a medicine this year for women. It's called Addyi. It's for hypoactive sexual desire disorder. It's called the pink pill. I have a lot of patients coming in and asking for it. Treatment options are also hormone replacement therapy and other medications that can help increase that desire and that want to be intimate with your partner again.